Welcome to Miles from Her View, the podcast where we dive deep into the unfiltered reality of fitness, strength training, and nutrition within womanhood and motherhood. I am your host, Kat, founder of Cat Fit Strength. I'm a career strength and conditioning coach, entrepreneur, lifelong athlete, and a mom of 2 active boys. In each episode, we explore the unique challenges and triumphs faced by women navigating the complexities of life. From juggling family and career to prioritizing self-care, we dissect the systems and the habits that shape our health and wellness. Join us for real stories, authentic advice, and genuine conversations as we empower each other to embrace our journeys and find strength in vulnerability. Today we have a special guest, Dr. Victoria Clement. She's a physical therapist specializing in pelvic floor health, orthopedics, and perinatal rehab. She's also a birth doula with a deep passion for functional fitness. Dr. Clement empowers her clients to embrace strength training, not just for athletic performance, but to improve their everyday activities. And I'm so excited to hear her incredible insights on building strength and resilience throughout the different life stages. So welcome.
Thank you so much for having me.
Definitely. I'm excited for you to bring and shed some light on pelvic floor therapy and that transition from just pelvic floor throughout the stages, and especially pertaining to birth, and for women who are looking to get into strength training, have always strength trained, or that lifelong athlete. I think there's so much information out there that can really empower a woman to not just stay active, but to go beyond that snapback mentality that we often see.
Yep. I'm so excited to talk about it. I love talking about this information because I believe everyone needs to know this stuff. So I'm happy to say whatever you want to know.
Exactly. And I think, I'm here to listen and also learn. Being a personal trainer is one thing that I'm clued in. I have a decent handle, but I'm always learning so much more. And I'm the first one to tell my clients, hey, when did that start happening? And sometimes they tell me, well, it started after baby number whatever, and their child could be, close to college. And I'm like, okay, it could be tied back, but that doesn't mean your body's broken. It's just when you go through pregnancy to delivery to life, there's so much that the body changes and that can be overlooked. And it's no fault. And I stress this with my clients. It's not a fault to you because life is so busy. You're focused on raising a child, working in the home, outside of the home, a combination of both. There's just a lot that happens. And it's natural that you get pushed to the back burner. And then I know for myself, when my kids were younger and babies, the eldest is 13 and the youngest is 10. Pelvic floor therapy wasn't something really talked about. Diastasis recti was just barely breaking, onto the scene. It was kind of new, which is shocking because I'm like, I'm so young. My kids are still young. So that's one thing I know. Once I learned of these things, especially going through my second pregnancy and restarting strength training and all of that and running, it was so different, the recoveries between both pregnancies. It was amazing. And I felt more empowered with that knowledge. So that's why I'm like, share your knowledge, So let's dive in. I would say, let's start with that woman who let's take that early postpartum woman. I often I don't laugh at that 6-week appointment, but that just undefined moment of the 6 to 8 week appointment where it's you're cleared for exercise. So really define what does that mean, and what, in your words, what you've seen, and what would be the best first steps.
That's a great question because that is so misleading. So misleading. And I hear it from my patients. I went to have intercourse with whoever and it didn't work out. It was painful. I'm like, I was cleared to do this. Or they went to go exercise and they felt the heaviness in their pelvis, or the leaking. That's a common one. Yeah. That's common, pregnancy or no pregnancy. People leak with their impact activities, lifting heavy. And that's a lot of what we see. Those are the main things I would say. There's pelvic and back pain. There's leaking, sometimes bowel issues, not as much as the leaking. And then the pelvic heaviness. So that is equated to pelvic organ prolapse, which don't let Dr. Google scare you. It's the worst of it on Google is like when you go to type it in, you see the worst of it. And honestly, 9.5 times out of 10, it's a mild one that can be resolved and you won't feel the symptoms as much or at all. And then like you mentioned, the diastasis recti. So people struggle to engage their core, all the pieces of their core. So like it's not just one muscle, it's a lot of muscles playing a role in here. It's your breath playing a role in it, coordination. So I would say those are the main things we see in general and a lot postpartum as well.
Yeah, oh, 100%. I always encourage my clients where yeah, so I always encourage my clients and stress that it's not just because you had a baby that these things are tied to. And, young girls who are teen athletes or college athletes can experience leaking as well. Men can also experience
Yes.
leaking and they also have a pelvic floor. So it's not a just because I had a baby, therefore this is my reality now, that it can be corrected with minimal to invasive treatments. And it does take some work. And I always stress that modifications and slowing down things, especially in the beginning, is going to lead to a stronger, more resilient body, especially as we get closer to the perimenopausal change. Um, and I try not to scare them like, oh, great, this is the next thing I'm going to always be changing. And, one step forward, two steps back. But it's let's build this foundation here. So when our body changes with the hormones and our pelvic floor naturally changes due to that, we have, we're walking into that with more control, dare I say, and more confidence to be able to continue doing the things that we love. Because for me, I'm a lifelong athlete, and it's like you can, there's so much life post having kids that you can still do. And I thought watching the Olympics was such a huge testament to all the women who have gone through motherhood and are still
Yeah.
at the top of their respective game, and also advocating for women's health in that realm, from pelvic floor all the way up, which is it's just massive. I was like, oh my God, it's happening. It's finally here. um,
I will say this, the people that we see postpartum that either worked with us or a trainer or somebody during their pregnancy, worlds of a difference postpartum in the recovery. It's easier, smoother, not as much to do, like rehab wise. So if you invest in yourself, like your time you put in the time during your pregnancy, it pays dividends later. Like you have a better pregnancy, one, you have a smoother labor, and then the postpartum recovery is so much smoother. It's not easy. It's never easy, but it's a lot smoother than it could be.
yeah, and I'm glad you brought that up because it is huge. And that is something as a trainer and working with women who are pregnant, I don't want to say always, but I'm checking in. I'm like, I know generally when things could crop up, and I'm going to ask them politely without being intrusive. But, if I can get them to a pelvic floor therapist and be like, no, you shouldn't be in pain. It's not just because your second trimester or it's your third child that you should have, you know, round ligament pain or these type of things. No,
Mhm.
you deserve to go through pregnancy feeling as comfortable and pain-free as possible. And a pain is a bit of a signal in the body that, like, hey, something's a little off. Doesn't mean it's very traumatically off. It's just a little off. And with a little TLC, we can bridge that gap and keep moving forward. I had a client who thankfully she was just like, I don't know if this is normal. And I'm like, hey, I'm so happy you asked. And I was
Yeah.
able to get her connected. And she was just like, it was a world of difference. She's like, I never knew this existed. And she's like, I feel foolish. I said, don't feel foolish. It is totally fine. This is my profession. I'm supposed to help you or no. And it is huge. I would love to hear. So, one of the things that I hear, and I am a C-section mama, is well, I don't need to worry about my pelvic floor because I had a C-section. Like, I won't have issues, and I know that's not true, but I'd love to hear, just kind of your experience with that, or maybe things that you have seen from C-section mamas.
I it's definitely worth looking into the pelvic floor too, because it's all one system. Your abs, your diaphragm, your pelvic floor, and like that whole corset around. I think of it like a soda can. It's all one system. So when you have a lot taking up inventory in your belly for like you have a baby taking up inventory, it puts a lot of pressure on the pelvic floor. Especially like if you were pushing during your labor and then it resulted in a C-section, your pelvic floor is not out of the woods. Even if you just had a scheduled C-section, your body changed. Your
Mhm.
hips and pelvis changed to accommodate that for that baby or babies that are in there. So with those changes in the pelvis and in your hips, the pelvic floor can get tight. And like that really can make a difference postpartum. It can make a difference down the line because like that pelvic floor loves to also compensate for other areas like your back and your hip, your lower core. So like that lower core, that's exactly where that C-section scar is. That pelvic floor is right on the other side of that bone. So it can tighten up and compensate for that scar tissue.
Yeah. Oh, you're so right. I mean, I know I'm gonna say my first C-section was textbook C-section. It was unplanned, and they were
Mhm.
like, "We just can't let you labor long any longer. Like, we need to sadly intervene." They tried. I mean, it was like 48 hours. They're like, "We need to like,
You
baby's
gave
not
it a good
moving
try.
down." He was a
Mhm.
big baby, so kind of grateful. He was my 10 pounder who was 2 weeks late, and he was almost 2 foot long. So I was like, "Thank you, bye." And yeah, he came out the size of a 4-month-old. So yeah, so my second one, unfortunately, I did have a complex pregnancy. I had complete placenta previa with leaking placenta, and I forget the wound up having like I'm gonna say minor accreta. I forget the medical term. So there was like adhesions. It wasn't very invasive. So they had to do was extremely emergency C-section. And so there was more incisions internally. And one of the things that I was grateful for was because I couldn't work out, I was on bed rest the whole pregnancy, but I was grateful for the knowledge of just breathing and like alleviating like
Mhm.
pressure off the pelvic floor. And then in that first couple weeks when I was trying to get up to the NICU and I don't stop. I'm like, yep, I got this. Let's keep going. It was like taking that time to be like, okay, let me focus on breathing, work on the core column, the soda can from diaphragm to get the fascia moving, things slowly moving. And
Mhm.
so, and then as I eased into, and I know it was not, I should have eased in slower. I kind of jumped back into a little bit faster than I should have. I paid for it and then I had to slow down. But like the deep core coordination with the muscles on the inside is a lot where, you know, for me, strength training looked different, running looked different, where it wasn't okay, resume where you just left off. It was focus more on that breathing, focus on that posture. And that I know can be really tough for clients to hear when it's just such a high pressure time of get that body back, get that
Yeah.
strength. And I fully
Yeah.
respect, like, you
Mhm.
want to feel really, really good. And as I tell my clients, I'm like, just because you can doesn't always mean you should.
Mhm.
And it doesn't mean the workouts will be easy. I can make them pretty challenging. Um, but we're focusing on that deep core connection, feeling that I always love when clients are like, I didn't know I had those muscles in my back. And I'm like, well, because they're huge. You need them to support your core and your pelvis. Because I always explain it as like the pelvis is like a rudder on a ship. And, it's not going to remain in neutral alignment the whole time. We want it to be able to move side to side, front, back. But when
Mhm.
it gets pulled in that front, and oftentimes postpartum, because by nature of pregnancy, we're more weighted on the front side, your center of mass is pulled out, things get pushed and pulled, and we want to just give back to the body to get it to your posture, to where, it was prior to ever having a child, where I can't remember what that felt like, but it's like that is what we want. So then you can be able to live in a functional body.
It's worth the wait and it's worth the patience to do the little things first because that's your foundation for everything else.
Oh yeah, 100%. I'm gonna say shift gears. And for that woman who might be listening is like, oh my goodness, I have never seen a pelvic floor therapist. I didn't even I hear about pelvic floor and I just Kegel, and which is, what I do. But I'm having some of these things, or I've been having maybe lower back pain. Is it ever too late for someone to get help?
No, never. It is never too late. Back when I was working for a company and I would see Medicare patients who are older people, I saw a woman, several women, but one in particular that I think about a lot. She was like 78 years old, leaking. She wore Depends all day long. And she's like, will I ever get rid of these? I'm like, we can try. We can see what we can do. So we did a lot of pelvic floor work. We did the core work. We worked on her mid back. And that woman got down to one panty liner a day
That's
in the
amazing.
70s. And she was so grateful. She was glad she tried it. She was skeptical, but if you know which places to treat and to work based on the person's individual needs, it can happen. You're never too late.
And I love that. And I think that is something that I feel like needs to keep being screamed from the hilltops, is it's never too late. And I know, especially from my industry, sometimes that's perpetuated. Oh, you waited too long, or that's too late. And it's like, no, the body is so resilient and you can build that strength. You can build these connections and, I'm going to say these muscle reflexes of connections to allow for the body to function better. Just you can feel better. Cause I'm sure she was like, oh my goodness, I don't have to wear this. Like, I'm sure it was a massive boost of confidence, you know?
Yes. Mhm.
So yeah,
And to
that's,
your point, like I've seen elderly women in their 80s and 90s deadlifting on social media. I'm like, it's never too late to start. You just need someone that's willing to help you and guide you in the right direction.
oh, 100%, 100%. And that's what I absolutely love. I think that is such a good, that's one of the things I love on social media, is when I see these women who are older than I am. And, I'm in my early 40s now. And I hear sometimes from people like, you need to slow down. I can't believe you're still doing these things. And I'm like, slow down. Why? I'm like, I
Yeah.
feel good.
What
Like,
purpose is there of slowing down? Unless you're running yourself into the
yeah.
ground and doing too
Oh
much.
yeah, no.
Like keep exercising as long as you
Yeah.
can. It's going to improve your quality of life. Like I've seen it as a PT in general, just people that stayed active in one way or another, they're happier, they're more mobile, like they like recovered better from their surgeries and injuries that they had. So like it's so worth it investing the time into the exercise piece and the nutrition, but that's another
Yeah, that's a
another
whole other
story.
thing. Yeah, no, and you're exactly right. And it's like, and that's what I tell my clients. It's like, just because, and I know some of it is a bit of like societal norms and stuff like that for women, like you hit the 40s, it's all downhill. You had a baby, it's all downhill. Like, I'm like, why are we so obsessed with this downhill thing? I'm like, it is not all downhill. I always tell the people, I'm like, yeah, there are some mornings I wake up and I feel like, whoo, a little stiff, a little like whatever. But I feel more energy, and I don't know, I don't want to say better, but I was an athlete in college, but I'm like, I have just as much, if not more energy now in my 40s, and I am so much busier. And I also value my downtime and my sleep like it's my job. I'm like, no, I'm sorry, I'm sleeping. I'm like, my phone's on airplane mode after 9 p.m. You cannot get a hold of me. I'm like, I'm going to bed. So
A lot of people are making their 30s and 40s their healthy era. Like they're turning it and flipping it like I'm stronger, healthier,
mhm.
like they're putting their attention on their health versus the 20s. Like the 20s were just like a wash. And now people are taking care of themselves and it's really showing.
Which is huge. And it makes me happy. And I hope it's like more wholesome because it's like, you need this. Like, you, not to be cliche, you only have one body to live in. Like, and there's so much within your control to make these years on this earth like good and moving forward, not just constantly moving forward, but like doing the things you want and challenging yourself in the way you want. And, and I also, again, drawing from the Olympics, seeing that change of what an athlete is. I remember growing up and it was like athletes were done by the time they were like 22, 23. It was rare to see an athlete in their late 20s. And a lot of that was, sports, science isn't where it is today, and the nutrition piece, especially for women, is not where it is today. Strength training, I remember like in college in the early 2000s, strength training was just like brand new for women in it. And I remember lifting in the weight room, and the male teams were like, "Why are you guys in here?" And I'm like, because we're athletes. And so we'd be throwing around weight and gaining strength, and they would be like confused by it. I'm like, hey, I love it. Like, this is
Yeah.
what an athlete is. And so,
I
yeah.
was an athlete too. And it's crazy how, like, in my teenage years and 20s and starting out as a physical therapist, I was running myself in the ground. I was stressed. It actually like segues into the origin of my business
Mhm.
because, and like finding pelvic floor because I was under eating. I was overtraining. I thought I had to run to lose weight. I want to be skinny. I don't want to be bulky. All the wrong things, all myths in my head, like for me. And I was got to a point in my old job where I was seeing multiple people an hour and totally exhausted and depression and gaining weight. And I was seeing these clients that had like pelvic floor issues and orthopedic issues. I didn't have the mental capacity and the energy to give them everything. And that is how I started my business actually. Like I wanted to give people more. Like I realized myself that I had pelvic floor issues and I was in my 20s. I was leaking, I had sciatic pain, I had pain with sex. That was huge. And didn't know I could fix that. And I was actually complaining to one of my PT friends. She said, "You should go see a pelvic floor PT." I'm like, oh, like that makes sense. Like it didn't cross my mind because we didn't learn about it in school, at least in my program, very in depth. So I went there. It changed my life. I got rid of like 90% of the issues I had. The other part was like a back issue and wanted to offer that to people. And again, I didn't have the time or the energy. So that's where I branched off and started my business, Restore Physical Therapy, because I wanted to give people the space and the time to go over like what's happening, what's going on in your life, what's the whole story. All of the details matter, whether it's like the nutrition, the sleep, the history, like what has your body been through? Like we need time to go through all of that. And also, like, I always found it interesting that I've never had kids. So I'm like, what goes on in that room? And then why is my patient having X, Y, and Z issues? Like, I want to know what's going on. So I decided to become a birth doula so I could see for myself what exactly goes on in that birth center, hospital. And it really made sense to me. Like, it brought it all together. And so that's how like I'm like we got to get people better, like we got to change things, we got to get them prepared during their pregnancy, even pre-pregnancy, like we got to get you well and get the discrepancies and like deficiencies balanced out. Collaborate with other professionals like personal trainers because you all keep everyone accountable and you see them often, constantly changing the program. And as for other clinicians out there too, like chiropractors are important. Like it takes a village of everyone. So with that said, like a lot of our practice focuses on the preventative and preparing people and making that recovery a lot better. There is on social media like a lot about like bouncing back, but that's so misleading. So misleading. Like your life's gonna look different, but not necessarily in a bad way. Like some people come out doing physical therapy postpartum, working with a trainer, and they feel stronger than they ever did. Like it just looks different than it did in your 20s. And you have to manage your time a little differently. Like you had mentioned earlier, there's no time in the day, and that's okay. Like if you're not sleeping, if you're not fueling your body, like it's not going to want to exercise. And that's just how life is sometimes. And you just have to roll with it. You do what you can. But as Kat and I are out here, like we're here to support everybody through whatever it is and find ways that work for your life.
Yeah, and I love that, and I full-heartedly agree, like, it is huge, and one thing I wanna reiterate that I love that you say, and to me, this is my opinion, but a practitioner who values the whole person, and
Mhm.
to understand that, I feel and I know and have had experience with practitioners who do that, the quality of care increases because and it's not just understanding like the whole body, it's like what is your whole story? Because everybody has a story through their body and through their life. And I feel and this is how I also work with my clients, like the more that's how you can create a better plan for them on their terms. Because no matter what season of life you are in, we are in such a fast-paced life that it is very easy to forget about yourself or be distracted and ignore. I mean, I'm in the business and it's like there are times where I'm like, I know what I need to do, and I will flat out ignore or make excuses and then be like, because the body whispers before it screams. And it's like, why is my body screaming at me? And that little voice is like, well, because we tried to tell you 4 days earlier, but you bulldozed through. And it's like,
Yep.
oh,
Yep. You gotta listen to those voices.
exactly. And I think, and for women, it is getting better all around, but it is tough to put the time into ourselves. And it's not always that we don't want to. I do see that it's like where to find the time. And so that's where I always love hearing from other people who are in my network who provide services that complement and really enhance like not only just my clients life or anybody who I come in contact with that it is going to be on their terms with
Mhm.
professionally backed, research backed support to keep them moving forward. And it's just, it's huge. And everybody's journey looks so different. And that's where I have that love hate relationship with social media is like,
Mhm.
you see, like, follow me on my journey through my pregnancy to postpartum. And it's like, cool, that's awesome. And go you do it. I think that can be great, but it can also be really, you know, tough for someone whose journey looks different.
Yeah.
Or like I can speak personally, I struggled hardcore to get back to me after both pregnancies and their respective. And it wasn't just because my body couldn't handle it or I was dealing with a lot. There was a lot emotionally to get back to my body. There was a lot just schedule wise. And the one thing is, even though, after I went through my first, I was in college coaching, so I didn't have my business at the time. And after I went through my second, I then
Yeah.
had my business. And it wasn't like, oh, I'm a trainer now. So naturally, it's easy for me to get back to me. It was a lot of the psychological switch that it is worth and not selfish of me to take this time. This time is paramount. And it isn't just so I can show my kids how to live healthy. It's because I deserve to put this time into me to live healthy and strong in on this earth. And, yes, aesthetically, it does. Yes, it is the ego boost. I'm not going to deny the aesthetics, but more importantly, it just gave back to me more and it wasn't from the purpose. And I try to like break this free is your sole purpose isn't just to serve your kids when you become a mom and that's why you should get healthy. It's You deserve to have you and feel good for you, not for your partner or for your kids solely. That's not why we're doing it. It's for you. It's like, when you buy you maybe that piece of clothing or so whatever, that's for you, or that guilty pleasure TV show, that's just for you. That's what some of your workouts or that time for you pouring into your health should be. But yeah,
Yeah,
it's
I
kind of
agree. I agree. I love that.
yeah. So let's see here. I'm trying to think, what else can we cover?
I think it is important to touch on social media a little bit. So it can be tricky. It can be tricky because there's a lot of people out there. There are a lot of people out there that have great information, that have the experience, have the knowledge, and just want to share it. But then there are some people that are like, I just want to go viral and this thing looks cool, so I'm going to talk about it. And it's so hard to navigate. Who do I listen to? And you and I had a conversation earlier about like, when people are saying never do this or only do that, like that's problematic. Like those are words that you should just be mindful of, like when you're looking at it. Like I never tell people you can never do this again or you should only do this.
Yeah, I would full heartedly agree to that. And it's so easy. I get sucked into some stuff. I'm like, wait, what? Am I doing it right? And I'm like, and it's like, no,
Yeah.
it's like you can easily get lost, and some of social media is for that likes and the virality of it. But the biggest red flags that I've seen is this is the only way, or the one secret, or the five best, exercises for diastasis recti. Well, honestly, it could be 100 different exercises,
Yeah.
and it goes back to what's right for you, your body, and where you're at. I mean, that's, I think, one of the cool things about exercise and in the world of physical therapy is that it's unique to you, and there are commonalities, but it's really hard to showcase on a 10-second reel, or whatever 9 by 16 square of like breaking down some complex topics. What would you say for someone who comes across an account and they're like, oh, this sounds really good, like things to look for to make sure, or even, I know we're in southeastern Pennsylvania, so
Mhm.
they may follow you on social media, but they may not be able to utilize your service because of distance. But for someone who's like, oh, I really want to find a pelvic floor therapist, what would be things to kind of investigate into to make sure it's credible research? They are someone who, you know, is a professional and knows what they're doing.
I think simply a green flag would be someone that collaborates with other professionals. So like like with, I'll say it both ways. So like personal trainers that are like, these are modifications, like I'm trained in this and I feel confident in this. But the minute there's a dysfunction of any kind, you send a PT. On the flip side, physical therapists, they're willing to refer out, like if they're not big on the fitness part or exercise programming, like they get to a certain level and they, like the person's a CrossFitter and they want them to go back to the CrossFit, but you send to the trainer that can help them get back to CrossFit. You know what I mean? So like seeing people interacting with other people in the community and not being like the I know everything is a green flag. As far as like credentialing and stuff, like you want to find a pelvic floor physical therapist or occupational therapist for pelvic floor therapy. Those are the people that are trained in rehab. I know there are people that call themselves pelvic floor therapists and aren't. So like they have like the chair in the office or the injections, like that's totally different. It has a time and like the injections and the medications have a time and a place, but it gets confusing out there when people see like pelvic floor therapists, but to its core, it is rehab providers, which are PTs and OTs. And then, yeah, like I said, people that are willing to give you the best, I don't know everything about everything. So, like, if I don't know, I'm willing to refer to someone that does better. Like, I want you to have the best. So that is what I look for. I don't love when people just think that they can do it all. You know what I mean?
Yeah. Oh yeah. And that's tough. It's like that gets, yeah, I feel you on that. That is huge to refer out and provide and know that, you know, for lack of better terms, you shouldn't be expected to know it all.
Mhm.
Because it's a lot of information. But yeah, and I will say definitely looking at the certifications or like the OT, like you said, because that's a big one.
Mhm.
I see a lot,
Mhm.
especially with personal trainers, where there isn't that certification with prenatal or postpartum,
Mhm.
and that understanding where, you know, it does take that understanding, and it doesn't have to be just a woman going through it. And I would argue, like, you have to know a little bit more because there was a lot when I went through and got certified after having a child that I was like,
Mhm.
I didn't know that. Like,
Yeah.
it was really interesting. Just because you went through something doesn't mean you are the expert on all of it. There are things like you're the expert on your experience. And that's where, and I will kind of throw this out there that like I've seen some really good male trainers who are pre and postnatal trainers. And
Yeah.
I'm like, man, they're great. I would go see them. So like being that, especially in that pregnancy thing, that like it isn't just isolated to only finding a female practitioner, and that there can be, you know, I don't know any of the top of my head, but like great male pelvic floor therapists if you feel comfortable with that, just, you know, so
Mhm.
but yeah, no, that is huge. Those red flags and really looking as to who and the accreditation of them is huge.
Mhm.
Um, and one of the things I absolutely love is seeing those providers that work with other providers because
Me too.
it's just you're gonna that individual is gonna have such a better quality of care. And I love that. When I first started, I actually started as an independent contractor out of a physical therapy office. And it was
Yeah.
so cool to, you know, bridge the gap from physical therapy to someone getting back in, and then also be able to be like, hey, you know what, you need to go see this person because there. And so there was acupuncture, massage therapy, nutrition, physical therapy, OT, chiropractic care, and then personal training all under one roof. And it was nice to be able to connect right there and just see how you can provide such a comprehensive care for the individual and see them get to where they want to go. I dare I say faster, but happier without this kind of like frustration there. So that's why I love when I have clients who are seeing, you know, many people in my network, and I love getting those text messages or emails from them because I'm like, cool, I can put together a better plan for them to keep them moving forward
Mhm.
versus playing like, and I hate to say it like this, but like guesswork, like, okay, I think this will work, but I don't have the full story here. I'm missing pieces of the puzzle. And it's not coming from like, I'm just pulling random things out. It's based off of these case studies that I've read, this should work. But when I have someone like yourself who's working with a client, I can be like, cool, that is that. Or those cues are working for that client. I'm going to carry it over here so
Mhm.
they see it in strength training and we can correlate it to everyday life, and they're more empowered versus really being scared in their body or scared to live, you know, actionably in their body. So,
I do that regularly with trainers. We have an email chain with the client as well. So
yeah.
there's a lot of times where they'll send them to me for like just a general evaluation of what's going on and what they need to focus on, and then I tag the patient and the trainer in there. I'm like, this is what I found, A, B, C, D. These are a couple I recommend integrating into it, but like do what like add what you want to do too. So
Mhm.
like you can have the best of both worlds here.
Yeah. And I love
Mhm.
that. It's huge. I feel like that is like going to be more the future, I hope.
I
More than
hope so.
I just it is huge. Like I've gotten to a point with myself where I'm like, if you know, I understand doctors and HIPAA with differences, but like other practitioners where I call it like the in between before you go to the doctor is like if they can't communicate or if they don't want to listen to, not that I'm gonna tell my life story, but understanding, you know, the pain and what happened preceded and post like it's not going to be a good relationship there. I'm not going to get the best quality of care from them. So it's like, nope, I'm not seeing you. So yeah. What else? What is kind of one thing I'm gonna do like a random, what is one thing that you're like, I don't want to say your superpower, but one thing like you absolutely love? It doesn't have to be related to pelvic floor that you're like, oh my goodness, like my clients or my patients would never suspect this of me.
People don't know this, but I compete in strongman competitions. So those people that pull trucks and lift heavy stones and kegs and all that crazy I do that. I'm crazy like that. So it's actually like really fun if you get the techniques right and someone teaches it to you and you're working on your strength training, you're working on your deficits in the middle. It anyone can do it. But I was telling Kat earlier that I have a competition coming up, not this weekend, but the weekend after. So that is one thing about me that people might not know.
I love it. I always find every person has that secret like challenge thing or like, and I love it. And I think, especially with strongman, like you're gonna have to have a pretty awesome working like pelvic floor because that's a lot of load on the
Oh
body.
yeah.
And
Oh yeah.
like,
You gotta
so
breathe well, your coordination has to be in line. You got to have that pelvic floor lengthen and strengthen. Like it can't be too tight. That's one misconception
yeah,
out there is like people do Kegels, Kegels, Kegels. Well, if your tissues are really tight, you're tightening a tight muscle. Like you have to learn how to relax and release it first, and then you have a better contraction for things like picking up a stone or picking up your baby, picking up your 20-pound baby. Like that that's all it takes. Like if
yeah,
the pelvic floor is weak and tight. So yeah, just like balancing it out, having good breathing with it, and the coordination of the breathing and the pelvic floor. It's everything.
yeah. Oh yeah, 100%. And I'm gonna jump back to, I'm glad you brought up the tight pelvic floor. So you mentioned earlier, and I forgot to jump back to that, is can you go into, are there signs or symptoms that someone may experience that could be of a tight pelvic floor?
They can have tight hips, trouble with tampons, trouble with intercourse, constipation, trouble emptying the bladder. So like if you have to stand up and sit down real quick, that can be tightness. Another one is, this one's a little less common, but like if you're wiping and wiping and wiping and the tissue's not getting cleaner, that's a sign of a tight pelvic floor in the back. And and the fact, like if you're leaking, like usually that's a tight pelvic floor that's not coordinating well with the rest of the body.
Okay. And do you find, just digging a little bit deeper, do you find this is predominantly something that happens to, I'm going to just use women in this context, like postpartum, or do you see it more before someone has kids, or is it doesn't discriminate, along the way?
It does not discriminate. I like I said, I was in my 20s. I haven't had kids and I had the tight pelvic floor. Whenever I got to the therapist, I was really tight. And it was a little bit uncomfortable at first, but like she made me feel really comfortable and safe in that situation. We were able to relax the pelvic floor, and that helped like really rebalance my body, and I was able to strength train again. Like it was crazy how much that tight pelvic floor played a role in my entire body.
That's awesome. That's awesome. Yeah, so let's wrap up. We'll have to have you back because there's so much to cover.
Yeah, we
It's
have so
not
much
just,
to talk about. We can do a part two and part whatever.
yeah, and it's huge. And I think there's a lot out there. I know, I mean, not just selfishly, but I'm like, I want to learn more. Because the more I know, the more I can listen for certain things for clients and connect the dots. But thank you so much, Dr.
Of course.
Clement, for coming and joining us. Where can people find you online? Where can you share?
We are www.restorethefloorpt.com. I'm Restore the Floor Doc on Instagram and TikTok. And then we have offices in Manayunk, Broomall, and Media. So if you need care and you're local, we're happy to help. We do free consultations as well. So if you're not
Awesome.
sure, we'll help you through it or direct you in the place that you need to go.
Awesome. And all that will be in the show notes. And so you have that and you can reach out. Definitely follow her. She puts out some great content. I follow her. It's awesome. So But thank you so much for having us on, and yeah, we'll look to future episodes with you.